Hello, my name is Adolfo Ascencio, Pharmacist Candidate of 2024. Today I will be going over the medication Vascepa. As a brief introduction, we'll be going over the medication Vascepa, also known under the generic name icosapent ethyl. Vascepa has two main goals in mind. As per the 2023 AHA and the ACC guidelines for cardiovascular health, Vascepa is specifically indicated as an adjunct to diet to reduce triglyceride levels in adults with severe hypertriglyceridemia, and these are indicated as triglyceride levels greater than or equal to 500 milligrams per deciliter. It is also approved to reduce the risk of cardiovascular events in adults with elevated triglyceride levels who have either established cardiovascular disease or diabetes, and two or more additional risk factors for cardiovascular disease. They can be added adjunctively to statins for more cardiovascular benefits as well. Let's go over some brief background information regarding this medication. So the main active ingredient is going to be icosapent ethyl, which is a highly purified form of EPA, which is an omega-3 fatty acid. It got its FDA approval in the USA in 2012, and this is to treat certain adults with high triglyceride levels. Vascepa contains a high concentration of EPA, which is an omega-3 fatty acid, just as available as over the counter, and they're known for the potential cardiovascular benefits. The approval for Vascepa was supported by the results of clinical trials. The most beneficial was the Reduce It trial, which demonstrated a significant reduction in cardiovascular events in patients treated with Vascepa. Vascepa is available by prescription only and should be taken under the guidance of a healthcare professional. Let's go over the pharmacokinetics of Vascepa. Pharmacokinetics can simply be defined as what the drug does once it's in circulation of the body. In the context of absorption, Vascepa is administered orally in the form of capsules. The active ingredient in Vascepa is icosapent ethyl, which is a type of omega-3 fatty acid, also known as EPA. It is also absorbed through the gastrointestinal tract with a peak time of 5 hours. Its distribution after absorption, EPA is incorporated into various other tissues, including plasma lipids, also known as triglycerides. The EPA is also transported to the liver. 99% remains as unesterified EPA. For metabolism, once it's in the liver, EPA undergoes metabolism to form its active metabolites. To list the exact metabolic pathway and details of its metabolites, it's not fully understood yet, so there's not too much information on how it's actually metabolized. But for elimination, we do know that EPA and its metabolites are eliminated from the body primarily through beta oxidation in the liver. Elimination occurs through pathways typical for fatty acids and does not undergo renal excretion. It does have a half-life of about 89 hours, so pretty long acting. As stated before, the mechanism of Vascepa is not fully understood, but it is believed to involve multiple pathways related to the metabolism of omega-3 fatty acids, particularly the EPA. Here are some key aspects of Vascepa's mechanism of action. So for the purified EPA, Vascepa contains the icosapent ethyl, which is the EPA, which is a highly purified form of it. It is derived from fish oil, but is more concentrated, but lacks other fatty acids typically found in fish oil. Its reduction of triglycerides is one of the primary effects of Vascepa. Elevated triglycerides are associated with an increased risk for cardiovascular events. The effects on lipid metabolism. The active component appears to influence various aspects of the metabolism. It's still not widely known as to how this gets metabolized, but very similar to as it would through the omega-3 fish oils. It also has anti-inflammatory effects. The EPA does treat chronic inflammation and is implicated in the progression of atherosclerosis and cardiovascular disease. The anti-inflammatory effects may contribute to the cardiovascular benefits observed with Vascepa. There are potential effects on platelets that omega-3 fatty acids are known for, and which can induce blood thinning. This can contribute to the mild anticoagulant effect associated with Vascepa. So, what are some indications for Vascepa? It is used as an adjunct to diet to reduce triglyceride levels in adults with severe hypertriglyceridemia. It is approved to reduce the risk of the cardiovascular events in adults. It has two different dosages depending on which one of the indications is being applied. For severe hypertriglyceridemia, it is limited to a maximum of 4,000 milligrams per day, and this is usually divided into two different dosages. So it will be taken two in the morning and two in the evening, preferably with meals. And then if you're using it for cardiovascular risk reduction, it has the same maximum dosage, but usually is given one capsule in the morning, one capsule in the evening with meals, and can be titrated up to the maximum dosage of the 4 grams. Vascepa is also available in two different strengths. They come in 0.5 grams or a 1 gram capsule. When it comes to Vascepa, the side effects are minimal and is considered a very tolerable medication. Some of these adverse effects included are, but are not limited to, are the joint pains. So some individuals do experience joint pain, stiffness, or swelling. This side effect has been reported in clinical trials, and about 5% of individuals experience joint pain. For bleeding, omega-3 fatty acids, such as those found in Vascepa, may have a blood thinning effect, which this can be beneficial for cardiovascular health, but it may also increase the risk of bleeding. Specifically, those on blood thinners have a 12% increase in risk for a bleeding event. For allergic reactions, although rare allergic reactions can occur, um, most symptoms do come from rash, itching, swelling, severe dizziness. It is contraindicated if the patient has hypersensitivities or allergies to shellfish or seafood. About 3% had any allergic symptom to Vascepa. For gastrointestinal issues, some people do and may experience such symptoms such as diarrhea, upset stomach, or indigestion, and that ends up being about 3% of the people on Vascepa. One of the more prevalent side effects is the burping or the fishy aftertaste. Vascepa is derived from fish oil, and some others may notice a fishy aftertaste or burping. This can be bothersome for some individuals, and about 7% of the individuals on this medication had this side effect. Peripheral edema tends to be another less prevalent side effect, but still present. It was present in about 3% of the patient's population, and this is where the body has a retention of fluid in extremities. It is very important for individuals who are on Vascepa who are routinely monitored for their safety and health. The main ones that we want to look at are the triglyceride levels. So this is regular monitoring of the triglycerides, specifically in Vascepa. If it's prescribed for the management of severe hypertriglyceridemia, this helps assess the response to the treatment and if anything needs to be done to either increase or decrease the dosage. For adherence to medication, um, some healthcare providers may inquire about or monitor adherence. The Vascepa regimen ensures that the patient is taking the medication as directed and also ascertain to follow appointments that are very important. Because of the bleeding risk that Vascepa does grant, um, it is important that they monitor for any signs of bleeding or bruising is usually advisable, especially in patients who are taking other anticoagulation or antiplatelet medications. Always monitor for any adverse effects as listed previously in the previous slides, and should promptly report any new or worsening symptoms to their healthcare provider. It is always important in any aspect to always monitor or try to implicate a healthier diet or lifestyle. And this is to a heart healthy diet and a regular physical activity may complement the effects of Vascepa. Here are some general classes of medications that may interact with Vascepa or require careful monitoring. While there are minor or even some severe interactions with some medications, these tend to be the most prevalent and the most of concern. As stated before, the anticoagulants and antiplatelet drugs, combining it with any other anticoagulant or antiplatelet medications such as warfarin or aspirin, Pradaxa, Xarelto, Eliquis, they all potentially increase the risk of bleeding. Your healthcare provider should be monitoring for any signs of bleeding and make any adjustments as needed. The second class that tends to be very not contradicting but can offer some interactions are usually NSAIDs. So these are the nonsteroidal anti-inflammatory drugs. Some NSAIDs like ibuprofen, naproxen, and some instances aspirin can also increase the risk of bleeding due to its acidity in nature. Using caution when combining with these with Vascepa, and then inform your healthcare provider if you are taking them regularly. There's always a discussion as to a difference between Vascepa and other over-the-counter fish oils. Most people question it. Is it even worth getting a prescription of Vascepa if the other fish oils provide the same effect? So let's just compare some general facts between both. So let's start with the active ingredient. Vascepa does contain the icosapent ethyl, which is a highly purified form of the EPA, which is an omega-3 fatty acid that is available over the counter, just not in the concentration that it is. For the FDA-approved indications, Vascepa is a prescription only, so it is usually only prescribed for those who are trying to reduce triglyceride levels in adults with severe hypertriglyceridemia or to reduce any cardiovascular events in the future. The over-the-counter fish oils are often marked as general health supplements, and their efficacy for specific medical conditions may vary. When it comes to purity, Vascepa does undergo a purification process to isolate and concentrate the EPA. It does minimize the presence of other fatty acids that are present in the over-the-counter ones. And then the over-the-counter, every other brands do vary significantly. Not all fish oils over the counter are indicated as the same. Um, and then the main one being that Vascepa is available by prescription only, indicating a specific medical need for this medication. Other fish oils that are available over the counter are just marked as dietary supplements without a prescription. Here are some clinical pros or some relevant information gathered from observation or factual evidence. For diet and lifestyle considerations, in addition to medication, healthcare providers may recommend dietary and lifestyle changes, and this is usually to complement the effects of Vascepa in managing the high levels of triglycerides. Um, you also want to consider cost consideration. Vascepa is a brand name only medication, and the cost considerations may be relevant for some patients. Checking with insurance coverage or exploring some other cost saving programs may be beneficial. Last but not least, let's go over some basic consultation points that should be addressed when starting a new patient on Vascepa. Number one is always take as prescribed, follow your healthcare provider's prescribed dosage and administration instructions. Typically, Vascepa being available as only oral products, it is taken oral. It can be taken with or without food, but to reduce any side effects from gastrointestinal issues, it is usually recommended to give in after meals. Um, when taking any kind of medication, specifically a medication that is important as Vascepa, consistency is key. You want to make sure it's always taken around the same time each day, and this helps maintain a steady level of medication in the body. You want to make sure the capsule is swallowed whole, then are taken with water. Do not crush, chew, break, or open the capsules, as this may affect the medication's effectiveness. As stated before, it can be taken with or without food, but to minimize that gastrointestinal side effect, usually given after meals. Always follow up with your healthcare provider. These appointments allow your healthcare team to assess your response to the medication and then make any necessary adjustments and address any concerns that you might have. It's important to stay hydrated or drinking an adequate amount of water is usually good practice and can help with the absorption of the medication to become more efficacious. And then last but not least, lifestyle changes. Discuss any recommended lifestyle changes with your healthcare provider, such as dietary modifications or increased physical activity. And once again, this just complements the effects for Vascepa in managing triglyceride levels and reducing the cardiovascular risk. And that concludes my presentation. These are my resources.